Welcome to the Deep Dive. We're really glad you could join us. And today we're tackling a topic that you, our listener, actually brought to us, along with some really excellent source material. It's a veterinary overview.
That's right, yeah. A deep dive into something many of us just have lying around the house.
Exactly. We're exploring the potential dangers of common, over-the-counter cold and allergy meds, the ones with pseudoephedrine and phenylephrine. What happens when our pets get into them?
It's surprisingly common, unfortunately. As the source material points out, pets and dogs seem to be the main culprits here, can accidentally ingest these things pretty easily.
Right. So our mission today is to really unpack this veterinary source you shared. We want to get a handle on what these substances actually do in an animal's body. What are the signs that something's wrong? How do vets figure this out? And crucially, what does the guidance say about managing it?
Yeah, knowing what to look for and what the standard veterinary approach is, it's really valuable for anyone with a pet.
Okay, so let's dive in. First things first. Pseudoephedrine and phenylephrine. What are we actually talking about here?
So the source describes them as synthetic sympathomimetic amines, which is a bit of a mouthful, I know.
Yeah.
Think of them as like chemical relatives of ephedrine. They essentially mimic the effects of the sympathetic nervous system.
The fight or flight system.
Exactly, fight or flight.
And where do you find these? Are they like prescription only or?
Oh, no, not at all. They're super common. You find them in tons of over-the-counter cold, allergy, sinus medications,
Yeah.
stuff you just pick up at the pharmacy.
Right. Different concentrations, I imagine.
Yeah, varying concentrations, which is part of the issue sometimes.
Okay. So how do they work then? Mimicking fight or flight. What does that actually look like in a pet?
Well, pseudoephedrine mainly works by making the body release more norepinephrine. That's a key fight-or-flight chemical. This stimulates adrenergic receptors all over. Phenylephrine stimulates some of those receptors directly.
And the result is?
The result is things like a faster heart rate, blood vessels constricting, which bumps up blood pressure, pupils get dilated, and the animal often becomes very alert, maybe agitated. Now, one interesting point the source makes is about phenylephrine. It actually has pretty poor oral bioavailability.
Meaning it's not absorbed well when swallowed.
Right. So generally speaking, it tends to cause less severe cardiovascular problems compared to pseudoephedrine, at least when ingested accidentally by a pet.
Okay, that's a key distinction. So pseudoephedrine taken orally is maybe the bigger worry for heart and blood pressure issues.
Potentially, yes.
Now, the source says any species can be affected, but is there one group that pops up more often?
Yes, definitely. The material is clear that dogs are by far the most commonly involved in these accidental overdoses.
Why dogs, do you think? Just more likely to chew on things.
Probably a combination of that, yeah. Their tendency to explore with their mouths, maybe less picky eating habits, and just, how accessible these meds can sometimes be left in a house.
Makes sense. So if a dog, or maybe another pet, does get into these medications, what signs should someone be looking out for? The list seems pretty long.
It is, and it all ties back to that fight-or-flight overdrive.
Right.
Common signs are things like dilating pupils. Vets call it mydriasis.
Okay.
Panting, a high body temperature, so hyperthermia, agitation, restlessness, hyperactivity, a really fast heart rate, that's tachycardia, and high blood pressure, hypertension.
Wow. Okay, that's already a concerning list. Are there other possibilities?
Oh, yes. The source also mentions vomiting, sometimes a lot of vocalizing tremors, seeming disoriented, and interestingly, sometimes lethargy instead of hyperactivity.
So it can go either way on the activity level.
It seems so.
Okay.
And then you get into the more worrying signs,
Yeah.
things that suggest it's more serious,
Like what?
like head bobbing, weird heart rhythms, sinus arrhythmia specifically mentioned, bleeding into the whites of the eyes, which is scleral hemorrhage, or even seizure-like activity.
Sure. Okay.
And in the really bad cases, acute collapse.
Gosh, that's a huge range from just panting to collapse. How long do these signs usually stick around?
The material suggests the acute toxicosis signs can last anywhere from 1 to 3 days. It often depends on the dose they got.
It sounds like if it's a severe case, the trouble doesn't necessarily end when the initial signs fade. There can be longer-term issues.
Absolutely. That severe stimulation can trigger a whole cascade. The overview mentions potential progression to DIC, disseminated intravascular coagulation.
Which is a serious clotting problem.
A very serious body-wide clotting disorder, yes. Muscle breakdown's another risk. You get myoglobin released. Shows up in the urine, that's myoglobinuria. and that can damage the kidneys secondarily.
Kidney damage.
Yeah, and in the most critical situations, there's even a risk of permanent damage to the central nervous system.
That's quite a leap from grabbing a cold pill off the counter to potentially permanent kidney or brain issues. It really highlights the danger.
It really does.
So what kind of dose triggers these reactions? Does the source give any specific numbers, like thresholds for concern?
Yes, and this is really important. The material gives some specific numbers to watch for. For pseudoephedrine, it says ingestion of more than just 1 milligram per kilogram of body weight can cause those initial signs: agitation, hyperactivity, panting.
1 milligram per kilogram. Okay, let's think about that. For a small dog, maybe 10 pounds, that's about 4.5 kilograms. So 4.5 milligrams.
Right.
And some human tablets have, what, 30 milligrams, 60 milligrams? Even more sometimes.
Exactly. So even a tiny piece of a tablet could be enough to cause noticeable signs in a small pet.
Wow, that really drives home how careful you need to be. What about phenylephrine?
The threshold for phenylephrine is generally higher. The source suggests you might need more like 3 to 4 milligrams per kilogram before seeing issues like vomiting, changes in activity, lethargy, or hyperactivity, plus the hypertension and tachycardia.
Okay. And within that whole list of signs we talked about, are there any specific ones that really scream serious trouble or suggest a worse outcome?
Yes, the material flags a few specifically. Head bobbing, the development of that DIC clotting disorder, or seeing myoglobinuria. Those are all pointed out as indicators of a really serious intoxication. I mean, the prognosis is more guarded.
Got it. So those are major red flags.
Definitely.
Now, given that the signs are basically an overstimulated nervous system, what else might a vet be thinking of? What other things could look like this?
That's a key question in diagnosis. Because the symptoms are non-specific stimulation, the vet has to consider other things that do that.
Like what?
The source lists other stimulants, other sympathomimetics. Things like, well, illicit drugs like amphetamines or cocaine, certain antidepressants, SSRIs, for example, phenylpropanolamine, which used to be common, methylxanthines.
Like caffeine or the stuff in chocolate.
Exactly. Caffeine, theophylline, and also ephedra, the herbal supplement. Basically anything that ramps up the system. It's about ruling things in or out based on history, if possible, and the clinical picture.
Okay. And what about lab tests? If they suspect it's pseudoephedrine or phenylephrine, do standard blood tests or urine tests show anything specific?
Usually no. The material says your standard CBC, biochemistry panel, urinalysis, they typically won't show unique changes directly from the drug in most cases. But in those really severe cases, the labs will reflect the complications. So you might see evidence of DIC on clotting tests, you might see myoglobin in the blood or urine, or you might see azotemia, which indicates kidney stress or damage.
Okay. Now, you mentioned history, but sometimes you just don't know what the pet got into. Is there any way to actually, test for these specific drugs?
This is where it gets quite interesting, actually, and it was a bit of a surprise nugget in the source material.
Oh.
Yeah. It turns out that urine or even serum from a pet that's ingested pseudoephedrine can actually trigger a positive result for amphetamine on some common human drug tests.
Wait, really? Like the kind you buy at the drugstore or even ones used in hospitals?
Exactly. It's a cross-reactivity thing. The test mistakes the pseudoephedrine for amphetamine. It's not definitive proof, but it's a really useful piece of the puzzle for a vet if they happen to run one of those screens.
That is wild. Accidental cold medicine ingestion makes your pet test positive for amphetamines. Okay, so let's say the vet strongly suspects this toxicosis, or maybe they even get that cross reaction on a test. How do they manage it? What's the treatment approach, according to this guide?
The absolute #1 priority, it says, is manage the severe life-threatening signs first. Address the immediate crisis.
Right, stabilize the patient.
Exactly. Then the general strategy is control the CNS stimulation. First, the agitation, the tremors, seizures if they're happening. Then manage the cardiovascular stuff, the heart rate, the blood pressure.
Why that order?
Well, the material notes that often, if you can get the central nervous system calmed down, the heart rate and blood pressure might actually improve on their own, or at least become easier to manage.
Okay, makes sense. So what medications do they use for that CNS control? For seizures or just extreme agitation?
For active seizures, the source lists intravenous options like propofol, pentobarbital, or phenobarbital. If seizures are really persistent, what they call refractory, they might even need to use gas anesthesia.
Wow.
And for the general agitation, hyperactivity, that kind of CNS excitement, drugs like acipromazine or chlorpromazine are mentioned as common choices. It also notes something interesting in antihistamine called cyproheptadine. It's apparently been used with some success for the dysphoria, that kind of unease or distress the vocalizing, and even helping with the hyperthermia.
What about the heart, that fast heart rate, tachycardia?
If it's sustained and causing problems, the guide says a beta blocker, like propranolol, might be considered. It's a maybe, depends on the situation.
Okay. So beyond the drugs targeting the specific overstimulation, what else is needed? Supportive care must be huge here.
Oh, absolutely crucial. If the pet's body temperature is dangerously high, hyperthermic, they need external cooling measures, like fans, cool water, that sort of thing.
And
Intravenous fluids are vital. They help with cardiovascular stability, support the kidneys, help flush the substance out, and importantly, protect those kidneys if muscle breakdown and myoglobinuria are happening. And monitoring is key throughout. The source stresses watching heart rate, heart rhythm, body temperature, blood pressure constantly.
And in severe cases?
In severe cases, you're also closely tracking kidney function through blood work, checking coagulation status, hydration, electrolytes. It's intensive care.
What about trying to get the stuff out before it's absorbed, like inducing vomiting or giving activated charcoal? Is that part of the plan?
It can be. Gastrointestinal decontamination, which includes making the pet vomit or giving charcoal to mine the drug in the stomach and intestines, is mentioned. However, there's a really important condition noted. It's generally only considered for patients who likely ingested more than that 1 milligram pseudoephedrine threshold. And this is the key part, are not already showing significant clinical signs.
Ah, okay. So if the pet is already agitated or tremoring, inducing vomiting is probably off the table.
Exactly. The timing and the pet's current state are critical. You wouldn't want to induce vomiting in an animal that's already unstable or potentially about to seize. It could be dangerous.
That leads to another really critical point from the material. Are there any specific treatments or medications that should absolutely be avoided?
Yes, and this is a huge warning flag in the source. It strongly advises against using diazepam.
Diazepam, like Valium. That's surprising. Isn't it often used for seizures or sedation?
It is, which is why this warning is so important.
Mm.
The source states that in pets with pseudoephedrine toxicosis, diazepam can sometimes cause a paradoxical reaction. Meaning, instead of calming the pet down, it can actually make them more dysphoric, more agitated, distressed, disoriented. It can potentially worsen the excitement.
Wow. So the go-to drug for sedation in many cases could actually make things worse here. That's crucial for vets and maybe even first responders to know.
Absolutely critical takeaway. Avoid diazepam in these specific cases.
Okay. So looking beyond the immediate crisis, for those severe cases where, say, kidney damage occurred, what happens next?
Well, the material mentions that if a pet develops renal insufficiency because of the myoglobinuria, that particular complication might need ongoing management. Long-term follow-up and care for kidney function might be necessary.
Right. Okay, so we've really walked through this veterinary source you brought us. We've looked at what these common drugs are, where you find them.
Yeah, the huge range of signs they can cause, from just mild panting to, well, really severe issues, especially in dogs.
We touched on diagnosis, including that surprising amphetamine test result.
Which is just fascinating, isn't it?
It really is. And then the management strategy, controlling the CNS first, supportive care, and that vital warning about avoiding diazepam.
And I think, the big picture here, the so what from digging into this source, is just how critical it is to keep all medications, even the stuff you buy without a prescription, safely locked away from pets, especially dogs, it seems. And knowing these signs, even the milder ones, means you can react faster, get your pet to the vet sooner, and give the vet crucial information if you suspect they got into something. Time really matters here.
It really does. It certainly makes you look twice at that bottle of cold pills on the nightstand or counter. So here's a final thought for you to chew on, drawing from everything we've discussed based on this material. Knowing that toxicosis from these common drugs can range anywhere from mild agitation all the way to life-threatening seizures, clotting problems, or even potential long-term kidney damage. How does understanding that potential severity maybe shift how you think about storing those everyday medications in your own home?
Something to consider. And thanks again for bringing this topic and this really informative source material to the deep dive today.